Merciful Lord, as we bow our heads in prayer as one community, we consecrate ourselves to your holy name. As we pursue our mission in healthcare and service for humankind, help us practice our subspecialty with concern for others. Serve every patient with utmost respect and compassion. Seek first the whole good of our patients, refusing to be influenced by any incentive. Share our knowledge and skills with our students and peers. Model in us what it is to be a good physician, striving hard to be the instrument of your healing power. Anoint us to conform to generally accepted scientific precepts and ethical principles. Never harm, degrade, humiliate, or exploit any person, whether a patient, a trainee, a pharmaceutical representative, or a fellow healthcare worker. Anoint us to work for the upliftment of public health and the socio-political conditions where infectious diseases can be controlled and moral lifestyles for all can be promoted. Give us the courage to do what is right and true, preserving in your love and believing in your justice and mercy. We ask that you bestow us your blessings and guide us as one community, dedicated to you as the true and ultimate physician. We ask this in your mighty name. Amen.
Give us this we shall do in spite of the odds. Our breath is taken from our own humble life.
With one voice, one spirit, and one dream.
United we shall work to make this nation great. Hail to you, PSMID.
Welcome and good evening to the closing ceremonies of the 42nd PSMID Annual Convention. Again, I am Dr. Pamela Ferrer, who will serve as your host for this meeting. If you're wondering, we are closing the convention on the fourth day, but this does not mean that we're not going to have any convention tomorrow. It's just that we're going to celebrate our Golden Ball tomorrow night, and this is very special for all of us. May I now call Dr. Maria Tarcela Glaire, Chair of the Research Committee, to give the awards.
So this year, we were able to do an online abstract submission for the Antonio Gonzaga Research Award. However, it was only open for about 3 weeks, from the second week of October until October 31. Despite of this, we received 54 abstracts where we have accepted 34. And of these, 24 were for poster and 10 were for oral presentation. So this afternoon, we had our oral presentation, and the winners were, Rose, can you post the certificates of the winners? So for the descriptive category, the first prize went to Dr. Christy Michelle Taladua, an infectious disease fellow of Makati Medical Center, where the title of her work is Presenting Characteristics, Comorbidities, and Predictors of Mortality amongst 236 patients with COVID-19. The second prize went to, next please, Junelle Poblete, who is an IM resident in Philippine General Hospital, with a title of Clinical Profiles and Outcomes of Patients with TB arthritis admitted in a tertiary hospital in the Philippines. And the third prize goes to him again, with the title of Genetic Diversity of Mycobacterial TB, Isolates from a Rural Community in the Philippines. For the analytical division, the first place, he will get the Antonio Gonzaga. She will get the Antonio Gonzaga Research Award. So it was given to Myvi Galon of San Lazaro Hospital, with a title of Early Predictors of Severe Dengue Fever from the WHO 2009 guidelines. I can barely do this. In adult dengue admitted at a national tertiary hospital. The second, to Erica Joanna Villanueva Caperonce, an ID fellow of Makati Medical Center, with the title of Predictors of Mortality in Patients with Staph aureus bacteremia. And the third prize went to Charlene Dizon and Lian Marie Ramos of Cardinal Santos Medical Center, with a title of Clinical Outcomes of Tocilizumab of COVID-19. I can barely read it, but that's the third prize. And for the for the Benjamin Limson award. So Dr. Benjamin Limson, as you know, is one of the pillars of infectious disease specialty in the country, and his research work focused mainly on therapeutics of Neisseria gonorrhea, typhoid fever, and lower respiratory tract infection. So to honor his legacy, the PSMID established the Benjamin Limson Research Grant in 2012. This would be a grant of 150,000 awarded to a proponent of a protocol, of a research protocol with a relevant ID issue. So in 2016, the grant has become a collaboration of the PSMID and PCHRD with a grant which could reach up to 2 million pesos. For this year, the PSMID, the grant will be announced by Dr. Isa Alejandria, our PSMID president. Thank you.
Thank you, Maricel, and congratulations to the winners of the Okay. Thank you, Maricel, and congratulations to the winners of the Dr. Antonio Gonzaga Memorial Research Award. Now, for the PCHRD-PSMID Dr. Benjamin Limson Research Grant, the recipient will be tasked to develop the National Antibiotic Guidelines app, and this is in line with the Memorandum of Agreement that we just signed last October 29 with the Department of Health through the Health Regulation Team, Pharmaceutical Division. So in this Memorandum of Agreement with the Department of Health, PSMID shall facilitate and organize the conduct of the AMS-related advocacy activities and develop a mobile application for the National Antibiotic Guidelines. So the recipient of this Benjamin Limson Research Grant is Dr. Brian Albert Lim. Okay. Congratulations, Brian, and we look forward to your development of the app. And together with the development is the updating actually of the National Antibiotic Guidelines, taking into account the presence of COVID-19. So thank you and congratulations again.
Okay, thank you, Dr. Alejandria, and thank you to all awardees. May I call my co-host, Dr. Alex Bello. Good evening, Alex.
Hi, Pam. Good evening. Sorry, nalita ako. Nawalan ako ng signal. Anyway, again, thank you, Dr.
It's okay.
Alejandria, and congratulations to the awardees. Now, may I call Dr. Mario Panaligan, Chair of NOMELEC, to present the new sets of officers for 2021.
Yeah, good evening. And of course, let me share the screen and present, of course, Board of Councils for 2021. They had the election yesterday or last night after the business meeting. So, I call on Dr. Marisa Alejandria, our president, again for 2021. Dr. Vigilor Maginsay, our vice president for 2021. Dr. Janice Kawili, our secretary. Dr. Arthur Desi Roman, our treasurer. Sorry. Dr. Carl Hanson, our business manager. And other members of the Board of Councils are Dr. Demelin Garcia, Dr. Joseph Adrian Buensalido, and Dr. Regina Berba. May now move on representatives from Cebu, Dr. Fiji Tambago. From Davao, Dr. Pamela Ferrer. And for Western Visayas, Dr. Dolores Romela Ruiz. Over to you, Pam and Alex, to call on our inducting officer.
Yes.
Okay, thank you, Dr. Panaligan. Congratulations to the new sets of officers. Now, may I call Dr.
Not yet,
Lansang?
not yet.
Mag-show po ba ng set of officers? Hello, Pam. Sorry,
So
Nola.
we will proceed with the oath taking. May we call Dr. Mary Ann Lansang, our past president, to lead the oath taking.
Good evening, everyone. Are the officers ready?
Yes.
Okay,
Yes.
thank you. So please raise your right hand. I state your name.
Joseph Adrian Buensalido,
Having been accepted as,
having been accepted as
state your position, of the Philippine Society for Microbiology and Infectious Diseases.
The
Philippine
Philippine Society for
Microbiology
Microbiology
and
and
Infectious
Incorporated.
Diseases.
Hereby solemnly swear
Hereby solemnly swear
that I will faithfully discharge to the best of my ability
that
that
I
I
will
will
faithfully
faithfully discharge to the
my
best
ability.
of my ability
the duties of the position,
the duties of the position,
that I will observe and support the organization's constitution
That I
I
will
will
observe
observe
and
and support
the
For the
organization's
organization's
of the
constitution.
Constitution,
and that I impose the obligation upon myself voluntarily
and that I impose the
I
obligation
impose
upon myself voluntarily
without mental reservation
Really.
or purpose of evasion.
without mental
without
reservation or evasion.
mental reservation.
So help me God.
So help me.
So help me God.
So help me God.
Congratulations, PSMID officers.
Okay. Thank you, Dr. Lansang. So may I call again Dr. Marisa Alejandria, our president, to present the presidential awards. Dr. Alejandria.
Thank you, Pam. Can you hear me? Okay.
Yes, we can hear you.
Okay, thank you. And for these presidential awards, I wish I could give everyone an award for work that we've all done for 2020. But yes, I have to limit the awards. Okay. Let me start off with Dr. Nina Verba for being our scientific committee chair for this virtual annual convention for the excellent and enriching holistic program and for the continuous commitment for AMS work. As I've mentioned, we've signed an memorandum of agreement already with DOH. No? So I look forward to you leading the AMS activities for PSMID. Thank you, Nina.
Thank you very much.
Next is Dr. Carl Hanson for the patient and efficient supervision and management of the logistics and technical needs of this virtual convention and for organizing also the COVID Gold Diagnostics webinar together with Desi Roman. Thank you, Carl.
Thank you, ma'am.
Next is Desi Roman, also for committed service to the society for managing the coffers of our society and for invaluable work in the development and updating of the interim guidance on clinical management for COVID-19, management of hemodialysis patients, infection control and prevention, and risk assessment of surgeries. So Desi has been helping me with the development and updating of the guidelines that we've released for COVID-19. Thank you, Desi. Then also a presidential award to Eva Rojas for also ably directing the development of CPGs also on infection prevention and control, risk assessment of surgeries, and the outpatient clinic resumption in the context of COVID-19. Then likewise to Mitzi and Sibel, so Mitzi Chua and Sibel Abad, they've been invaluable work in also developing and updating the interim guidance on clinical management. And Mitzi for volunteering to come up with teaching slides on COVID-19, especially during the early part of the pandemic. And Sibel also for participating in the webinars willingly. Okay. Thank you, Sibel and Mitzi. Next is Janice. Janice, thank you for your committed service to the board for continually ably representing PSMID in the TB activities and advocacies, and for leading PSMID in the HIV Quality Improvement Network project together with Kate. Okay. Thank you, Janice. And Kate, Kate, thank you for the ongoing commitment to improve HIV services using a one-stop shop model and for initiating the participation of the Philippines in the HIV SNDQI network and inviting PSMID to partner in this project, and also for facilitating the distribution of PPEs to various healthcare facilities across the country, together with Dr. Saniel. Thank you for helping out with Dr. Saniel and for managing the distribution of these PPEs, which were donated by towns and UP Manila Foundation. Thank you, Kate and Dr. Saniel. And then next is Mafi. Yes. Thank you, Mafi, for effectively leading the program production of the Gala Night. So for leading the whole team in the Gala Night. So we're excited to watch the Gala Night tomorrow. Thank you, Mafi. Next is Pam. So Pam, thank you also for a committed service and for organizing the opening and closing ceremonies from Davao virtually. Thank you, Pam. The next, our information specialist, Minette and King. So thank you, Minette, for feeding us with relevant updated literature, no? COVID-19 and other relevant infectious diseases, no? And King for curating the literature. Next, thank you, Jelsa and Marion, for managing, no, the media interviews, creating the much needed infographics. And I look forward to you taking the challenge posed to us by Professor Mike Tan, no, on improving our risk communication strategies and communicating our health messages more effectively. And, thank you, Jelsa and Marion. Next is the tandem of John and Chi Abu. Thank you for actively working in tandem, no, to ensure that the training program and accreditation parameters are aligned. Thank you for your flexibility and implementing adaptive solutions to ensure, no, that the training and accreditation activities are not disrupted despite the pandemic. Thank you again, John and Chi. And next, allow me also to give a recognition to Ian Cabaluna and Inday Dance for initiating the development of the rapid evidence reviews, which help us in preparing our interim guidance, no, guidelines for COVID-19. So they were the ones who recruited the volunteers to do the rapid reviews of the literature on COVID-19. And last is I'd like also to recognize Dr. Tony Dance and the algorithm constructors, no, for initiating the work on converting our guidelines into algorithms together with the other societies. So thank you, Tony, and to our algorithm constructors who willingly volunteered their time to work on the algorithms. That's it. So thank you very much to everyone for the support and the work that you've done for this year, 2020.
Okay, thank you, Dr. Marisa Alejandria, and congratulations to the presidential awardees. Again, may I call the re-elected president of the Philippine Society for Microbiology and Infectious Diseases, Dr. Marisa Alejandria, to give her presidential remarks.
Presidential remarks. Thank you, Alex. No. So, is it a presidential remark? Closing. Okay. I am really at a loss of words, no, for this second term. So first, really, again, it's a time to praise and thank the Lord, no, for a successful convention. While we still have another day tomorrow, I really think, and I think all of you will agree that we have an overwhelmingly successful convention, and we thank the Lord for that. Thank you for bringing together brilliant and creative minds, no, who were up to the challenge of holding this virtual convention. So allow me to thank the organizing committee led by Dr. Veglor, then Janice, Pam, and of course, Nina, our scientific committee chair, and Carl, Desi, our officers of the day. Again, Carl, Gabsi, Jemmy, Desi, Maris, Joanne, Mark, Andy, and for tomorrow, Jelsa. May kasama si Jelsa. Okay. And Claire. Okay. So, maraming salamat. Okay. So, you really made this convention, this virtual convention, a success, no? And I'd like to thank you all for the trust and support that you have given me, no, in this difficult year for us. No? So I'd like also to specifically thank also Dr. Alora for the words of wisdom and guidance in this difficult year. Indeed, this pandemic has challenged us, but I would say that PSMID's role goes beyond being leaders in the front lines of delivering healthcare. No? So we've seen that in this pandemic, we are not just clinicians, we also led in the training of our healthcare workers. We developed advisories, position statements, and provided science-based information to guide policy and practice. We adopted guidance without sacrificing ethics and equity. Having said that, now we've seen that we are quite effective in coming up with our guidelines. In the year, in next year or in the succeeding months, no, we now need to focus and strengthen our strategies on effective communication, as well has been posed as a challenge to us earlier. So I think this is where we now we really need to work together to come up with effective risk communication strategies, effectively communicating our health messages, translating our guidelines and algorithms to digestible, chewable parts. No, I think we need to work on that for our healthcare workers to be able to understand and deliver quality of care. No? So we have to disseminate it in really digestible material, no? And more understandable, friendly material. And I think that is what we need to focus next year as we plan for next year. No? And as we strategically plan, no, in expanding our horizons next year, no, we need to continue to focus on adaptive collaborations. We need to innovate with creative solutions, continue critical thinking, and as I've said, come up with effective communication strategies, taking into consideration the lessons that we are learning from this pandemic. We need hands, hearts, and heads to work together as we move forward. And we continue to put our hope and faith in the Lord as we answer the call from above, no, to continue to serve our patients, our countrymen, for His glory. So thank you, everyone, and look forward to another term with all of you. And I'm inviting everyone tomorrow. No? So this is not the end yet of the convention. We're just closing this scientific sessions, but we are still we have activities to celebrate our 50th anniversary tomorrow. So please watch the COVID Chronicles and then listen to the Dr. Elpidio Gamboa, and Dr. Bienvenido Alora Memorial Lectures, followed by our Gala Night, our Golden Ball. Thank you and have a good night, everyone.
Okay, congratulations, Dr. Alejandria, and congratulations to all of us in PSMID. May I now call Dr. Veglor Maginsay, our overall chair of the PSMID Annual Convention, to give her closing remarks. Dr. Maginsay?
Thank you, Pam. Dr. Marisa Alejandria, officers and members of PSMID, esteemed speakers, colleagues, ladies and gentlemen. It has been a long 4-day convention, but I think everyone will agree that it was a very rewarding convention, scientifically and non-scientifically. Allow me to thank you all for your active participation. It is my wish that whatever learnings we've gathered in this convention will positively transform us to better clinicians, more compassionate healthcare providers, motivated to continue to do our best, and hopeful for a better tomorrow that will certainly come in God's perfect time. In behalf of the PSMID board, I would like to convey our gratitude to the speakers and panelists, other medical societies, associations, and allied professional organizations, pharmaceutical and technical partners. Your presence, participation, and support greatly help to ensure success of our convention. Moreover, if I may use Dr. Lansang's word, this convention indeed has served as an incendiary event that has unquestionably shown that COVID-19, as it affects anyone regardless of race, age, sex, status in life, can only be beaten by a unified initiative from all sectors and stakeholders, both private and public. We are therefore looking forward to more collaborative projects and activities with our old and new partners in the management and control of infectious diseases. Big thanks also to the organizing committee, chairs and co-chairs of each session, moderators of the industry satellite symposia, and the assigned officers of the day for your unconditional commitment and unwavering patience and perseverance to develop and deliver an excellent convention. There is no big or small effort. Every contribution counts and counts significantly to the success of this conference. May I also recognize the able support of PSMID Secretariat and staff. Thank you, Rose, Iris, June, and Manong. While I may be delivering the closing remarks now, that does not mean that we are done, for tomorrow is another great day, PSMID's 50th anniversary. I therefore invite you all to celebrate with us. Let us witness together the sharing of COVID experiences by the different PSMID training institutions, hospitals, and chapters in the COVID Chronicles. Listen also to Dr. Angeles Tan Alora in the Dr. Elpidio Gamboa Memorial Lecture as she brings us down memory lane of PSMID's 50 wonderful years of service, training, and research. And to Dr. Mediadora Claudia Saniel in the first Dr. Bienvenido Memorial Lecture as she inspires us more to persevere for a richer tomorrow and truly expand the horizons for PSMID. Be at your best for the Gala Nights production, which will culminate in a toast of joy, gratitude, and hope. Once again, thank you, everyone. Stay safe, always, in all ways.
Thank you, Dr. Masai. Thank you, everyone, for attending the closing ceremony. Again, may I invite everyone to the last day of our convention and to the PSMID Gold Bowl tomorrow night. Good evening again, everyone. Thank you.
Good night.